Hello and welcome. I'm Michael Phillip, your physical therapist, and today I want to give you a general timeline of what to expect following a lower extremity amputation surgery. If you're preparing for an amputation, you just had one, or maybe you have a friend or a loved one who has undergone one recently, then this video will hopefully give you some peace of mind knowing when and what to expect following the amputation. We're going to start from day 0, the day of the procedure. Now, following your procedure, you will likely be visited from the doctor and one of his many assistants in the care team in order to see how you're doing and to discuss the process moving forwards. The typical hospital stay is going to be anywhere from 5 days to 2 weeks. Now, during this time, you'll get regular visits from nurses to give you medications, take vitals, and perform dressing changes. You're also going to be seen by a physical therapist and or occupational therapist early on to initiate light range of motion, strengthening, and stretching activities, discuss positioning of the limb. He or she will also be teaching you how to move around in bed, use assistive devices, and perform transfers. It's going to be a busy first couple weeks in the recovery. You'll also be visited by a prosthetist in the first few weeks who will discuss the process of getting your prosthetic limb and which type is right for you. They will also do some education with you on reshaping the limb and how to manage swelling, so once you do get your first prosthesis, it will fit comfortably. Following discharge from the hospital, you'll be going to physical therapy around 3 times a week to continue strengthening, stretching, and limb management. As the wound heals and there are decreases in pain, swelling, and tenderness, you'll be fitted for your first temporary prosthetic limb and begin gait training during your physical therapy visits. This typically occurs between 8 and 10 weeks following your surgery, but can vary greatly. During physical therapy, you'll start off by just getting used to standing in your new prosthesis. Then, after a week or 2, you'll begin taking your first baby steps in parallel bars. You'll then progress to a walker and then possibly either to a cane or forearm crutches. After that, once you've demonstrated good strength and stability, then you'll start walking on your own. Walking comfortably in a prosthetic limb can take anywhere between 4 and 8 months, which depends a lot on your specific health condition, your amputation type, and the strength of not only your limb, but your body as a whole, as you'll be requiring a lot of upper body strength early on. Then, at around 6 months, the limb volume will start to stabilize, and you may receive your first permanent prosthetic limb. You will continue physical therapy for probably 6 to 12 months, also depending on your overall health and goals. Those with high physical activity goals who may require advanced prosthetic limbs, they may take even longer to reach those higher level goals. During your first year, you'll also be in regular contact with your prosthetist for adjustments and modifications, and have many follow-up visits with your doctors. So, between your therapist, your prosthetist, your doctor, and his assistants, you're going to have many eyes on you throughout the process to ensure you're progressing well. After the first 8 months to a first year, you're going to be busy getting used to your modified life, but hopefully with a lot more independence. After the first year, you may expect to continue with some physical therapy and continue to have some visits with your prosthetist for ongoing adjustments. But once you've made it this far, you should be going pretty good at this point. Now, I hope this video gives you a better understanding of the timeline following the lower extremity amputation. But as always, if you have any more questions, feel free to contact us or look for our other videos that may cover your questions. Thanks again for watching and have a good day. Take care.